Hi, I'm Dr. Mark Murphy, and I'm the lead faculty for clinical education at ProSomnus Sleep Technologies, and it's always fun to talk to people that are getting started in dental sleep medicine. Now, if you've already gotten started and you're still watching this video, maybe you're just trying to pick up a couple of tips or tricks that'll help you move along, let me see if I can help. To those of you that are newer to dental sleep medicine, I want to remind you that you're fortunate to be working in a family of devices like I get to, the ProSomnus Sleep Technology, the CA, LP, the Evo, the newest addition to our family, certainly the PH or the Precision Herbst, and then the Iterative Advancement IA and the smaller IA Select. Incredibly precise devices. Oh my, did I say precise? I sure did. Well, that's going to be a very important starting point for us to talk about oral appliance therapy with ProSomnus. Precision devices require precision impressions. And although there are plenty of people in this world that can take an incredibly accurate alginate or silginate or heavy body, light body, one-step impression, if I gave that technique to 100 dentists, I would have more remakes in alginate than the next most remakes in silginate, than the next most remakes in heavy body, light body, one-stage impression techniques than I would in the particular procedure that I'm going to recommend. If you want to have excellent success with ProSomnus devices, which are very precise, we don't just need a precision impression at the prep, we need it everywhere. If we don't have a precise impression, that's when device manufacturers use soft liners, or they print them in nylon, or they use ball clasp for retention, which really means the device is only fitting there. With ProSomnus, they fit well everywhere. And that's why we don't get the tooth movement you see with some of the other devices. But that's going to require a two-stage impression technique, a putty, let it set completely in the mouth with a piece of saran wrap over the top, then remove the saran wrap, light body wash, you're home free. I've used a lot of Kettenbach materials in the past. They're a little bit less expensive. When you're taking full arch impressions, you're up there in $30, $40 land. It's always nice to save a couple of dollars. And that Kettenbach material works very, very well. I've had excellent results with it. Putty, full set with saran wrap on top and a light body wash after that to completion. Upper and then lower. If you do that, you will have an excellent time. Very seamless and no stress delivering those devices very, very quickly with minimal adjustments. The bite registration is also important. When you go to take a George gauge or a protrusive bite record with any of the other devices, you measure the range of motion forward and back, and let's say for the sake of example and simplicity, that was 10 millimeters in range, then we would try to start about 50% into that range. Some other manufacturers would have you start a little bit further than that, but that's because their devices are larger and don't allow for as much tongue space, and they have to protrude further, which certainly does invite a risk of a few more side effects and a greater challenge of them having bite changes. So with ProSomnus, we don't have to start quite as far. Turns out in a recent abstract that I published, average starting position on a series of cases was 50.3% of the range of motion, and those patients resolved with an average 1.29 millimeters of advancement. So that means 50% was pretty close, and 36% of my patients resolved at the starting bite position, 0, 0. That's a good indication of where to start. Now, I happen to use a snore test, so I have them pinch their nose, lean their head back, make a snoring sound, then put the George gauge in, and if they have trouble making a snoring sound, that would be a good place to start, if they're also comfortable. So temporomandibular joint and muscle comfort, doubled with a negative snore test, helps me get a good feel for the horizontal aptitude I need for the starting bite position. If that's not working quite for me, then I start to add a little bit of vertical, because we do know that there's a three-dimensional capability. My friends in pharyngometry start with a little bit more vertical. People with neuromuscular bite techniques will use TENS units to relax the musculature and find a relaxed position. Matrix Plus people will test that out in a 2-night overnight study. There are lots of great ways of taking the bite. The George gauge or protrusive bite record is so common that I thought I'd spend the most time on that. If you're getting started in dental sleep medicine and you take these kinds of precise impressions and excellent bite records, either with a little futar on them, or if you're scanning, I don't put anything on the bite fork. I just scan it the way it is, as long as the patient can hold that still. And if they can't, I put a little dab in the posterior on each side and maybe a little bit up in front so they're stable. And then I scan the space in between, stitches the two models together, voila, and we're off to the internet. So try those things and they're going to help you really start in a precision way to work with ProSomnus sleep technologies. You'll find it easy.